Good morning. My name is Allison Thurman. I'm a senior level nursing student at William Carey University. And this morning I'll be talking about infection control and hand hygiene. First, I'd like to discuss the different precautions for different types of patient populations. First of all, we got standard precautions, and that's when you want to put on gloves when you're dealing with blood and body fluids or open wounds or anything like that. Basically, if it's wet, put gloves on. Next, I want to talk about airborne precautions. That's when you're dealing with organisms that are smaller than 5 micrograms. So you want to wear an N95 respirator. These patients need to be in their own private negative pressure room. And those are patients with TB, measles, or like COVID-19. Next, you're going to have your droplet precautions, and that is for organisms larger than 5 micrograms. Those types of patients include people with pertussis or mumps. And you just want to wear a regular face mask, and they still need to be in a private negative pressure room. Up next is going to be your contact precautions, and that's when you're going to get close to the patient and they have an infection like in a wound or in their urine, something like that, a multi-drug resistant organism like MRSA or herpes, stuff like that. You really want to go ahead and wear your gloves, gown, and if there's a possibility of splashing, you want to wear a mask and a face shield or goggles. All that information can be found in the ATI RN Fundamentals book on page 52. Up next, I'm going to demonstrate good hand hygiene. You want to use good hand hygiene before and after patient care, even in between glove changes when you're doing procedures like a dressing change. And it can be washing your hands with soap and water or an alcohol-based hand sanitizer. But today I'm doing good old-fashioned soap and water. So we'll do that now. First, you want to take off your watch or any other thing. You want to roll up your sleeves to get them out of the way. You want to go ahead and turn your water on to a good temp that's comfortable for you. I think this makes it hot or fast. I don't know. So your hands, get your hands all wet. And then you want to get some soap, a good amount. You want to start lathering it up real good. You want to do this for 15 to 30 seconds. So a good way to get to your whole 15 to 30 seconds will be to sing Happy Birthday a couple times or some other little songs, or just count. You want to make sure that you're scrubbing your palms real good, the backs of your hands, in between your fingers, and you want to clean your nail beds and under your fingernails if you have them, if they're long enough. Make sure you're getting your thumb good, and you want to clean your wrist. You want to be sure to never bring your hands above your elbows, because that's going to change the angle and cause the water and all these germs to run back up your sleeve, or whatever's going on. Alright, so then you want to go ahead and rinse. You want to start at the wrist and go down, let it run down. Make sure you never touch the inside of the sink. You're going to get all the soap off. You want to grab your paper towels. And you want to dry from your fingertips to your wrist, still being sure not to pick up your hands over your elbows. Like that. And then you take another paper towel to turn the water off and clean up the sink if you need to. Then you can put your watch back on. Alright, and that concludes my video. Thank you for watching.